Get ready for a no BS approach to health and fitness. This is NBS Fitness Radio.
All right, welcome back to NBS Fitness Radio. I'm here with Lucas Trautman. Lucas is a board-certified psychiatrist. He's also been a member of NBS Fitness for how many years now?
Oh, man, perhaps 8 years.
Awesome, cool.
Yeah.
And we want to have him come on today to kind of discuss mental health, how it relates to physical health, strategies to improve mental health, all that. But to start, just kind of give us like your background, how you got into this. Just kind of introduce yourself.
Thanks, David. So honored to be here. I'm a board-certified psychiatrist, like you said. I'm in practice as medical director of Oxford Treatment Center down in Mississippi, residential treatment center for substance use disorders. Also, medical director of PCS, Professional Care Services. It's a community mental health network in West Tennessee.
Okay.
I have a inpatient practice at Lakeside Behavioral Health.
Nice.
And then I also collaborate with a couple mid-level providers that provide ketamine treatment for treatment-resistant depression.
Interesting. Okay. Very cool. That's awesome. That's a lot. You're like bouncing all over the place.
That's what we do.
What inspired you to pursue that field?
So I'm a fourth-generation doctor. So that was kind of like always the family business and what I was encouraged to do. When I went to medical school, I really liked working with kids and working internationally. So I did pediatrics first. Did a master's of public health and international health and tropical medicine, worked a little bit in Haiti, Southeast Asia. And in these environments, especially in the emergency room, there were all these adolescents that didn't have good psych care. You know, if they were abandoned or, you know, nobody wanted to deal with adolescents. In the emergency room, physicians didn't know what to do if they were homeless or whatever. Yeah. So I really bonded with those kids. I was a wrestling coach also back in the day. And so I really loved the adolescent population and decided to do a psychiatry residency and just absolutely loved it. 2006 to 2009. Okay. That's when I became a psychiatrist and just never looked back.
That's awesome. What do you feel like I feel like the mental health psychiatry has really kind of like come to the forefront of common culture and talk here recently. I feel like maybe a couple of decades ago, it wasn't as freely spoken about or discussed as it is now. What do you attribute that change to?
Well, honestly, leaders like you in the fitness community really encourage us to seek our liabilities and be honest about them and take ownership for our liabilities. Part of that is mental liabilities, lifestyle, sleep, how you feel, how you treat others. So I think there's an encouragement over the past 10 years to seek ownership of your liabilities. And we sort of destigmatized talking about mental health. Also, we had a lot of people who died. We had a lot of veterans who died, a lot of active duty who died. People in that space decided, you know what, we're going to talk about this.
That makes sense.
You know, there's a really big campaign within in the active duty community as well as the veteran community to really try to end the 22 veteran suicides per day. Yeah. And so becoming unafraid to talk about these issues kind of, that catalyzed it as well, I think.
I don't know how much in the training y'all go back and studying like history of psychiatry, history of mental health, but from my observations, what I see is a general decline, the feeling of decline of like the mental health of Americans. You feel like it's the case that is the case, like our mental health has been declining, or has it always been about the same, but maybe it wasn't expressed as much, there wasn't as much discussion around it? Like in the 1950s, was mental health basically the same, or has it gotten worse?
So it's a great, interesting philosophical question, and I think we can look at it a couple of different ways. While we have more mental health resources and we've destigmatized talking about mental illness and seeking that help now, true, we've got unique stressors. We got social media. Yeah. You know, we got the constant competition for our dopamine and our time. We have children who are introduced to Instagram and social media. Yep. We have, where mental health has come into the forefront recently that I see in the space that I'm in is mass shooters, fentanyl, sex traffickers. These are things that didn't really exist in the 1950s. So we got more mental health availability, but we also have really unique challenges to face as well.
Yeah, and I also say these unique challenges are changing and morphing at an ever increasing rate. So your ability to adjust is stressed as well because it's just constantly changing.
Yeah, and people are busier. Some working class people have to really hustle now.
Yeah.
They don't have necessarily, they have to really fight and struggle and be creative to gain the time to work on their mental health.
Yeah. Okay, so that's a good place to start. So what is mental health?
Another great question, man. It's I would say general feeling of wellness, the feeling of well-being, feeling of happiness, decreased stress, functionality. And there's two ways I think we could look at it today. We have the mental health and wellness space of I'm depressed because I'm run ragged, I don't exercise, I don't sleep, I'm anxious, I've got, poor boundaries with abusive relationships, stuff like that. And then we've got the big psychiatric disorders that need different kind of treatment.
Yeah, so you have the kind of general mental health of impacted by the stresses of typical American life, and then you have like maybe the just genetic disorders and those are separate. And maybe that's part of the process of it. The destigmatization was it felt like it was all the same.
Yeah.
And now we're saying that these are different.
If you acknowledge that you had any kind of mental health concern, they're like, okay, you've got this.
Yeah.
When really you just had the basic, normal, healthy people stuff.
Yeah.
So mental health, it's a feeling of wellness and it's where functionality and your feelings are congruent. I mean, if you've known someone with PTSD who has significant real physiological stimulation, they go to bed and they drench the sheets, that's not in their brain. It's a real despairing PTSD, or schizophrenia or bipolar disorder. I mean, these are neurobiological conditions.
Yeah.
Of course, they need wellness also. But then we've got the whole other sphere, which is people, just in everyday life who endure stressors, have poor coping to the stressors, feel terrible, and then end up taking their lives as a result of it, kind of silently without any warning.
I gave a presentation the other day, and part of the presentation was talking about like proper management, mental health, and I had to give a definition of what poor mental health was, or what poor stress management was, is really what the question was. And I looked it up, and it said it was persistent. So the stress was persistent, it was overwhelming, and it was negatively impacting other areas of your life. And I was like, okay, that seemed like a good kind of definition, and maybe pushes people away from being like, I had a stressful day at work, I'm depressed. It's like, well, like stress is not a bad thing. Stress is actually a good thing. The question is like, is it persistent? Does it feel overwhelming, like you can't deal with it? And is it negatively impacting other areas of your life? If you've got a stressful day on a regular basis, but you got good coping mechanisms, you can maybe compartmentalize a little bit and kind of buffer between, okay, that was work's over, now I'm at home, and you're not carrying it over. Maybe that's like kind of a good way of thinking through so that was what I looked up. How would someone know? We talked about what good mental health is. Well, what does poor mental health look like? What are some maybe emotional, mental, physical signs of it?
Yes, so complex. So I would say number one, it can be subjective.
Mm-hmm.
Someone could identify that they are feeling terribly. That's not always present. Yeah. Someone could say, I'm fine, but they have psychomotor slowing. They cry all the time. They have recurrent thoughts of death and dying. They're not eating enough. They have poor sleep. So those are some examples of major depressive disorder that someone could have objectively. But let's also take into account their subjective point of view. If they say I'm overwhelmed, if they say I feel terrible, I'm hopeless, I think those are some warning signs as well. We kind of take and put them together.
how would you kind of maybe distinguish between that? Because let's say, like maybe my coping mechanism is venting. So, I know I maybe say, yeah, I gotta get this on my chest, and I vent, and I say I'm overwhelmed, and this is ridiculous, but like I'm sleeping fine, I'm eating fine. Like, what do we rely on more? Do we rely more on the subjective or the objective? Like, how do you navigate that?
Yeah, it's a good point. I mean, if it depends. Let's say we have an operator who's not verbose, and they come to you, and they say, "I feel like I don't want to be here anymore."
Yeah,
that's a subjective point of view that I'm going to take seriously. Yeah, if you've got the venter, and at the end of the 15 minutes of venting, they feel fine and good, and they're sleeping and all that, that's less acute. Yeah, you're right. Okay. Yeah. They did a lot of subjective venting, but they're okay. I think objective findings are very important to look at because you can't fake them. Like, did somebody have a 30-pound weight loss? Because of grief. Yeah. Stuff like that.
Yeah, that makes a lot of sense. I guess, what do you see? Maybe give it, I'm just like some avatar examples of like, these type of people tend to show mental health stress in these ways, and these types of people tend to see it or show it in these ways.
Yeah, interesting. All these different personality types. So there's have you heard of the Enneagram? Mm-hmm. Yeah. Love it. I love it because it's just basically a personality inventory. It's not a horoscope. You take a 200-question personality inventory and you kind of get clumped into one of 9, I think, things. And so all these different personality types respond to stress different ways. The one I'm an 8, and it's the protector and the rebel. Yeah. And what they tell me, and my family will have to tell if this is true or not, but the way I deal with stress is to take charge and to try to make lists, take charge, conquer things, eliminate the stressor. Some people, I think like the 4 is kind of like the artist, they retreat, they shut down. Stress, boom, they're done, they're gone. You don't see them, they're dysfunctional, they're non-functional. Yeah. Coping is such an important thing, and you mentioned it twice. Coping, okay, so we could feel overwhelmed, we could have a persistent stressor, but if we can encapsulate that in the day, do 15 minutes of sauna at night, stimulate our parasympathetic and sleep like a baby, we're going to respond a lot differently to this disempowered, overwhelmed person who just eats cereal, watches TV till bed, and then goes to bed in a sympathetic state.
Yeah. Okay, so let's talk about what some of the typical physical representations of poor mental health, excess stress, like how does that present itself physically?
Yeah, so it can be a myriad of ways, but some really common ways are it's called cortisol. Yeah. So it's the irritability from cortisol in an anxiety disorder, overeating from cortisol, or undereating from cortisol, poor sleep from cortisol. I think cortisol and the sympathetic nervous system drives a lot of it. Yeah. That's why we're seeing a lot of movement back towards sauna, which increases the lifespan. Everybody knows it now; it's well established. Deep breathing to stimulate parasympathetic tone. Taylor Somerville's doing a lot of that. So other examples of sort of the drivers of poor mental health and what we would look for, I think cortisol, sleep, PO intake, those are the big ones because they're pretty objective.
Gotcha. So it's essentially being overstimulated with stress. So that is the sympathetic nervous system drives this neurochemical cortisol up. And then that represents itself as I'm having trouble sleeping, or maybe I'm not getting enough sleep. I can't fall asleep. I can't get restful sleep. Or the other extreme, which would be I just want to sleep all the time.
Yeah, and it's interesting. Just like you said, stress can be good. Yeah. So we're gonna intentionally later today create cortisol in that gym. Yeah. In a controlled manner. And then that cortisol is going to drop and we're going to rest. And it's not overwhelming. It's not persistent. Yeah. It's a good framework that you mentioned. But yeah, some things that can drive up cortisol, stressful job. Yeah. Poor boundaries between humans who aren't good to us. Yeah. Getting in bad relationships, toxic relationships. That's a cortisol driver that I see all the time. Or just losing yourself in the countless hours on your phone. Yeah. Constant stimulation, traffic, coworker, kids, which are beautiful stressors. And then looking at phone or TV all the way till bed.
Yeah.
You don't give yourself time to just kind of de-stress at the end.
Yeah. So if someone's kind of like, if we were going to try to help someone kind of somewhat self-diagnose, we might say, are you having sleep issues of either of the extreme? Like, I'm sleeping 12 hours every day, or I feel like I can't fall asleep. I can't get good restful sleep. Also eating. You feel like this, I'm never really hungry. You know, I don't know, not really hungry. I kind of just eat a little bit, kind of eating like a bird. Or the other is just like, I'm always famished. I'm always craving this sweet, dopamine hit of whatever the sweet stuff is. And just find myself just constantly binging. Either one of those would be, anything of the extreme would be a kind of good, at least, it would be a good initial diagnosis of like that you may be experiencing excess cortisol from excess stress.
That's right. And then it also leads to substance use and alcohol.
Yeah.
So the other objective finding I would look for is, am I drinking? Has illicit drug use increased?
Yeah.
Did I hang on to those pain pills from my knee surgery and then I kept taking one a day because it alleviated my anxiety better than scotch?
Yeah.
Am I in that world? If you're in a substance use world, then that's another objective finding that you want to look at to determine if you have listeners right now who say I'm in that group. Yeah. I do. Yeah. I feel overwhelmed. I have a persistent stressor. My ex is terrible. We've got, 10 more years of alimony. I feel hopeless. I feel trapped. Then you have to follow that with treatment. It works. Treatment's available. You're not trapped. You're not alone, because a lot of people are in that space of feeling overwhelmed and they die by suicide. So many people die by suicide.
Yeah. So let's kind of, I want to talk about the two things though, because one would be the common causes of stress. And let's dive into that a little bit. And then it sounds like the other piece would be like stress must be coped with. Mm-hmm. What is important is that we find the quality coping mechanisms versus using coping mechanisms that actually don't help and actually make the problem worse. Mm-hmm. So common causes of stress, and then like why, like a little more of the specifics. You said job, but like what are some specifics around kind of profession that cause stress?
Having a poor team leader that you report to who doesn't, value you, micromanages you, doesn't know how to use an assets-based approach to get the best out of you, doesn't really care. So your supervisor.
So it'd be your superiors.
Yeah, your coworkers. You could have just toxic people that make your job miserable every day. You don't have a team that's cohesive, that's looking out for you. You're looking out for them. You're going through life as a team, just feeling amazing around your team. You got somebody against you at work.
Yeah. Okay, that makes sense.
That's workplace stressors.
Yep.
Remember, family of origin stressors are huge.
Yep.
Like we're adults, but let's say we have an adult who has a family of origin abusive relationship with a parent that was, 30 years old and has ceased, but it happened when they were 10 years old. They were manipulated when they were a little kid. So then their dealings with the world and maybe even of themselves are dysfunctional. They could have self-image problems. They could overextend constantly because they're trying to prove their worth.
Yeah.
Because dad didn't give them attention. And that's causing stress because they're overwhelming themselves with elective work that they don't need to be doing.
Yeah. So we got workspace stress. We've got familial stress. What else?
The current relationship stress. You got a spouse who doesn't listen to you, doesn't care, isn't aligned with your needs, and you keep expressing what your needs are, but they don't listen. You don't have a thoughtful, mindful spouse that is sitting down wanting to engage you in your journey and have a give and take.
Yeah.
I see that cause a lot of people stress in my practice.
100%. Yeah.
Other causes of stress, like you said, are poor coping. Yeah. I mean, we all have stress, and so many coping mechanisms available. People do have control. They have power over it. I mean, physical exercise extends the lifespan. And it improves mental health. There was a study at the end of 2023, which is better, running or SSRIs for depression? It was running.
Yeah.
Clearly. Yeah. And, oh, by the way, it makes you live longer.
Yeah.
You know, so you have control over that.
Yeah.
You don't need a doctor. You don't need anything for that. You just need to, find someone who knows how to coach you in progressive overload and going slow and learning how to be a jogger. And that could be anything. I mean, they just used running because that's easy to quantify, but it could be anything where you break a sweat. It's better than antidepressants.
As a doctor, can you prescribe that? Like I'm 100% on board with that. I think I'm fully aware of like the impact of health and fitness on mental health. And I don't think it's I think there's causation and not just correlated that we have such few Americans who do exercise, and we do have such high levels of mental stress issues. Mm-hmm. I also recognize that a lot of times the medical field is lagging behind a little bit and tends to is 100% more medical intervention than lifestyle intervention. So it's like a doctor. Like, can you actually prescribe someone to exercise?
I mean, we always have tried. I mean, the COVID situation really drove that home. We saw that people who had obesity were having worse outcomes. We've been trying to get people into lifestyle for 100 years.
Yeah.
You're in an internal medicine clinic. You're always counseling on diet and exercise that can help lower the metabolic risk, thus get off the meds. It's tough. People don't necessarily listen to that. They choose lifestyles that lead to disease and decreased longevity. So when we see people as physicians, it's usually when they've reached that point, they need that. They got end-stage renal disease. You got to go down this route because these people are critically ill. But yeah, I don't know of many doctors, I think, who wouldn't just love for people to take better care of themselves.
Yeah.
We're sort of forced into the role of that type of caregiver, and that's how we're reimbursed is
right.
You can't, I don't know of a like billing code where you just kind of come do a exercise, evaluation. Right. I mean, we need that, but the wellness space, the fitness space does that because when I'm looking to increase performance for some physical activity or even body recomp or whatever, like I don't go see a doctor for it. They're going to treat end-stage renal disease, and that cool. I'm glad they're there. Or they're going to do a thoracotomy or something if you're in an accident. It's the wellness people. It's the dietitians. It's the people who know about exercise and fitness and metabolic health that you look to. They're the doctors of that space.
Yeah, I would agree. What I see is that the common man doesn't see that. Like what they would go to the doctor probably somewhat unaware of the sickness within them. So they'd go to the doctor and the doctor goes, "Hey, you're pre-diabetic, you had an A1C of blank. And on top of that, your blood pressure is 130/85, so not great." And it's like at that point, it's like, hey, the prescriptive medication would be you need to go exercise.
We do it.
And then they don't. Yeah, and then they come back, they go, okay, now you are diabetic, so we're gonna have to get you. Yeah. So it's a function where it's like, gosh, like we did prescribe it, but they just didn't listen to it.
Well, and taken to the extreme, I had a patient who had liver failure from alcoholism, who was late 30s.
Yeah.
Got a liver transplant. Of course, we're saying stop drinking. And we're in treatment facility with this patient. Liver failed, got a liver transplant. You'd think, little kids, you'd think that would be the no more alcohol moment. But the way they looked at it is, I got a new liver.
Okay, sorry.
We're good to go.
Yeah.
Let's go. So that person died.
Ugh.
But wouldn't it have been great if they listened? Why don't they listen? Is it fear? I mean, they don't.
Well, I would say that person is an addict.
Yeah.
And they're obviously addicted. I guess the question, but why doesn't the person who's not isn't addicted to substance.
I think it's similar. I think they're addicted to their routine, their lifestyle. They, I mean, the resources are out there.
It's maybe the person with substance abuse and addiction, the friction point of overcoming it's too great. It's similar with someone who's maybe not what we would clinically say addicted to an unhealthy lifestyle, but the friction of overcoming it's just too much.
I like thinking about it in those terms. I like thinking about it in those terms of addiction even.
Yeah. I'm totally pro that. Like I love taking it to the show. It's like, man, like, no, you're addicted to a lifestyle that is unhealthy for you, does not benefit you, does not benefit the people around you, and you should change it, period.
Right.
Like, full stop.
Well, okay, so looking from the 1950s till now, this shouldn't be controversial, but we've a lot of people in my space talk about this, where we have sort of infantilized the Gen Z and some of the millennial generation, where we are shielding and coddling them from hardship. And so what happens, they lose out on, and our kids now lose out on doing hard things. Yeah. And then there's sort of victims to what is life going to do? A lot of generations, a lot of people, my wrestling community, we take the bull by the horns and we take care of business. But a lot of people now are kind of just completely shielded from doing these hard things of growth. Yeah. And I think that's a reason why mental health in America is suffering, because people no longer have to do hard things. We're coddling them.
Yeah. So then going back to the coping mechanisms, what I would say one of the benefits of exercise to me, and specifically very difficult exercise, like not walking, but like getting your heart rate up to zone 5 and feeling like it's gonna explode out of your chest, is you just kind of learn an ability to be okay in the discomfort. You learn how to do hard things. You learn that it's eventually going to be over. You also learn that there's times where I need to rely on other people and ask for help,
right?
Because this is too physically hard for me. I need some help right now.
Yeah.
And so less stubborn about saying, like, I'm in a difficult spot that I haven't been in before, and I need some help.
Yeah.
And I recognize I do need some help, because I do believe that there's a path through this. I'm not hopeless. I'm just stuck, and I need to figure out I need someone to help guide me through this so I can get to the other side.
That's so key, but that's so important. I mean, you look at some of the hardest dudes in America, in their profession, they're asking each other for help. They know they can fail. They know what losing looks like. They have completely pushed themselves to the limit. A lot of people who don't know that hardship, who don't know that wall, are under this sort of delusion that they're in control and that they're never going to lose. But pushing yourself all the way, it humbles you in a way that's very empowering, I think.
Yeah. So obviously exercise is a great coping mechanism, but why? Like, why is it a good coping mechanism?
It can't be overstated how important exercise is. Well, number one, it's very accessible. So, let's run through it. It's very accessible. It extends lifespan. It's a stress reliever. It's better treatment for depression than SSRIs. I mean, let's start there.
How does it relieve stress?
So when you exercise, you and I both subjectively know that feeling.
Yeah.
But it increases parasympathetic tone post-exercise. So maybe it won't if you do a zone 5 workout. You may be a little tachycardic for the rest of the evening. You know that is going to happen. But for most exercise, you're parasympathetic, you feel great, you feel relaxed. You have a neurotransmitter flood of dopamine and serotonin, and those are the happy neurotransmitters.
And for anyone who's unsure of what we were saying about like parasympathetic and sympathetic, maybe explain that.
Yeah, so there's the fight or flight. I'm getting flushed skin, I'm anxious, my heart's racing, I'm having a panicky feeling. That's the sympathetic, the catecholaminergic, adrenal glands just going.
Yeah.
It comes from our time on the savannah where the leopard's about to chase me and I've got to run. Because we're just cavemen in this concrete jungle now. Biologically, we're still wired for the savannah.
Yeah.
Parasympathetic is the opposite. It's the rest and digest state that your nervous system can get into, where you just feel relaxed. You just got out of the hot tub. Like if somebody gets out of the hot tub and it's a sunny day and they feel amazing and they sat in there 20 minutes and they get out and they drink some cool water and they feel relaxed, that's because they've stimulated their parasympathetic state, which is the opposite of the fight or flight sympathetic.
Yeah. And so one thing that exercise does is it almost like swings. Like if you think someone who doesn't exercise kind of just sits in this middle zone, they're never at true top end sympathetic, but they never actually feel the parasympathetic. So what exercise does is it swings the pendulum up. Ooh, I'm going to actually experience sympathetic
briefly.
Yeah. So that they can swing back the other way. So like one of the powers of exercise is it gets it to swing back into the rest recovery.
Yeah. I love that metaphor. Well, exercise is accessible. One beautiful thing that I discovered over the past probably 3 years is zone 2 training.
Yeah.
Very accessible, very easy to do. Brisk walk, swim. Peter Attia likes to say that he gets on his Peloton, he does it, and as long as you can have a conversation but a little uncomfortable, that's zone 2 training. Yeah. You do that, it just blossoms your mitochondria. Yeah. Your mitochondria density improves, which means you burn fat a lot easier. Yeah. You're in a zone where you're using oxygen to burn fat rather than the glycogen in the higher zones. And then that zone 2 builds a base of a pyramid where, Goggins only trains in zone 2, but once you have a zone 2 base, which is very accessible, then you can do zone 5 3 times a week, recover super quick, feel amazing, and kind of increase your VO2 max and have the best of all worlds.
Yeah. The easy way I explain that to people is like you always recover aerobically. So the better your aerobic base is, the better your recovery. Yeah. So if you want to do the high intensity stuff more and get better at it and recover from it faster, have a good zone 2 base.
It's true. So every August we do a fundraiser for Naval Special Warfare, Navy SEAL Foundation, and it's the New York City SEAL Swim, and it's a 3.5 mile swim, and it's a bunch of push-ups and pull-ups, and it's on a hot day in the barges, and the current is bad, and in order to train for that, I asked how to do it, and these operators are like scary dudes, and they were like, LSD, long, slow distance. What do I need? And they said LSD, long, slow distance. Because on the first day, I'm like slanging weights, and I'm like going to failure on pull-ups, and they're like, no, this is a 3-hour extended event, and you need to be able to do this. So I invested like a whole year in zone 2. Yeah. And I didn't really do much high-intensity training at all. And on the day, the event director, who's a SEAL, Bill Brown, he said this. He briefed us. I'm one of the only non-military in the water, and he says this is a no BS swim, and we've got current and this and that. And so my Garmin, I was in zone 4 the whole time during the swim in the Hudson on all that current and swells and everything. But it was easy because I had built such a massive zone 2 base. Yeah, and it blew my mind. Like for my whole life as a wrestler, I had the mindset as I'm going in there and training anaerobically, which is also so important. Yeah. But I didn't know really about the zone 2 base. I didn't know about that life. But it's so accessible. You can have injuries. You can do anything. You can find a way to get in zone 2.
Just walk up and down your stairs. Yeah. Like everyone can do zone 2, and I think one of the things that the takeaway from that is like when you say it's so accessible, meaning it's like it's not, you don't have to know technique. You don't have to have equipment. You don't have to get motivated to do it. It's like, you can start with just a nice, easy, fast walk. Yeah.
People don't think it's accessible. They say, I can't do that. Yeah. Those people are in shape. Yeah. I can't do that. But yeah, of course you can. Yeah. You can set the lifestyle that can do that because you can briskly walk. You can get on a stationary bike and do it until you're just uncomfortable, but still can maintain a conversation. You don't have to get special like gear to know if you're in zone 2. Just, exercise tolerance. Yeah.
If you need to, you can watch TV while you do it. I mean, like, I'd prefer you not to eventually, but if that's what gets you, like, I really want to watch this TV show, but I know I need to exercise. All right, well, we'll just combine them.
Yeah, and that brings another reason why exercise is good is mobility. Yeah, and being able to get off the couch and heal from injuries when you're in your 80s. Yeah. So I mean, exercise does that, and you do a brilliant job breaking that down on Instagram. Exercise, movement is medicine. Period.
One of the things you were talking about mobility, the ability to get off the couch is, there was some statistic from the NIH, but I want to say it said that lack of social relationships increases your risk of death by 50%.
Yeah.
And I said, the example, I was like, I want to paint the picture of a man in his 70s who's hasn't well maintained his body, so he struggles to get up off the couch. He struggles to get up the stairs, or maybe he struggles to go down the basement to do the woodworking that he's always done that kind of gave him life. He's got grandkids who are super active, but he's tired all the time and his joints hurt, and so like it's a struggle to go and do the things that they want to do. And then his wife dies, and then his friends are dying, and he, because of physical limitations, is unable to engage in the world in a full way. And so the negative health consequences of that are extreme because of the physical health consequences of lack of exercise.
100%. Yeah, you said it really well.
So we got exercise as a coping mechanism. What are some other coping mechanisms?
Sleep.
Yeah. Why?
Well, because I was at a conference 2 days ago, and they had a picture that when we're in stage 4 sleep, there's little janitors scrubbing our brain.
Yeah.
Cleaning up the neurotoxins.
Yeah.
So it does a lot of things. It repackages memories from the day. It creates a hormonal health situation where we get HGH. We get all types of male and female hormones that the men can have and the women can have that make them feel happy and help their body process their metabolic needs and their food. When we have, our cells in our brain are assaulted by different, free radicals and stressors of the day and byproducts of our metabolism. Even though we feel good and healthy, we're in this constant state of cleanup.
Yeah.
And so, these things become neurotoxins if we don't sleep, and you have a higher risk for neurocognitive disorders like dementia if you don't sleep. So sleep is important because it makes you feel good if you get a good night's sleep. It decreases stress, but it also physically helps prevent major neurocognitive disorders like vascular dementia and Alzheimer's dementia.
The crazy thing to me about that is the cycle that creates, because lack of quality sleep increases neurodegeneration.
Yep.
And neurodegeneration causes lack of quality sleep.
Right.
And so it's like, man, to me, that's like this fearful, you get stuck on this treadmill loop that you can't get off of. Like if you're at 60, you start getting neurodegeneration. It's like,
right. And you don't want medicines to get you to sleep, because medicines, if it's your last resort, sure, but there's so many things in our power to get good sleep, and medicines don't allow us to go through those, to cycle through those levels, those stages of sleep like we need.
It's unnatural sleep that doesn't create the cleanup parasympathetic swing that we need. You become less. It's like somewhat similar to alcohol. Is that alcohol, because it's depresses your consciousness. So it doesn't help you sleep. It just makes you less conscious.
Yeah, you have terrible sleep with alcohol because it wears off in the middle of the night, and you have rebound withdrawals, rebound tachycardia, and you have cortisol, of course. There's a retired SEAL, a dear friend of mine named Robert Sweetman, who has an Instagram called Sleep Genius. This is what he does. He's a sleep scientist now.
That's awesome.
And he is out to promote health. I mean, he's also a wonderful dude. He does fundraiser marathons. He does the New York Swim with us,
cool.
And he's a humanitarian. But Robert Sweetman, look this guy up, Sleep Genius. He is promoting healthy sleep and healthy lifestyle for sleep. It's like his thing now.
That's awesome. I feel like for a lot of people my age, there's a lack of awareness and appreciation of what sleep is and the negative impacts of poor quality or quantity of sleep. And it's one of the things I'm like constantly encouraging people, like, dude, like, go to sleep, get 8 hours. And I have been like, I'm fine off 6.5. I'm like, dude, you're not. Like, it is like, we wouldn't tell you to do a 1 rep max squat every day, because your body would not be able to fully recover from that. Well, getting 6.5 hours of sleep is like doing a 90% max squat every day, where it's like I can kind of recover from it, but just over time it just like beats me up, and like it's just like then I am injured. That's why then I do have the knee injuries. Or in the sleep case, it's like you are dealing with some mental stress issues because you've consistently let cortisol build up. You haven't brought down. You haven't given yourself full good nights of sleep. You know, these things that kind of build up over time. I was in a business conversation with someone who said, well, this just may be a period of your life where you just don't get 8 hours of sleep. And I was like, man, that's not really worth it to me.
Yeah.
I said,
you have the choice.
I said, I literally have seen the negative impacts of that across generations. And quite frankly, like, I want to do everything in my power to know who I am and who the people around me are when I'm in my 80s. And I probably won't regret not doing more work, but I sure would regret like not knowing who I was or my grandkids' names.
No, that's right. Because I mean, to your point, while Alzheimer's can have some genetic risk factors, by and large, it is a lifestyle disease.
Yeah.
Major neurocognitive disorder. That's what we call dementia now. This is a lifestyle disease. Vascular dementia. The number 2 cause of dementia is due to frequent strokes and hypertension caused by lifestyle.
Yeah.
You know?
Yeah, 100%.
You can help prevent dementia if you get adequate sleep. That's coming from a board certified physician.
Yeah. And I think like I'd like to point out that the 2 things that you stress as coping mechanisms, exercise, sleep. I mean, it's like, do what you're naturally designed to do. You're meant to move, man. You're meant to get sleep. Do the things you're made to do, and your body works the way it's supposed to work. You know,
I think people people are unaware of the sleep thing. I think that you are a colleague of Peter Attia, Rhonda Patrick, and this message is getting out slowly. But what you're doing is so important because this is the future of medicine. It's empowering people to do what they already have at their fingertips.
Yeah. So we got exercise, we got sleep. What else we got?
Healthy boundaries in relationship.
Okay. Yeah.
I think managing your relationships, whether it be with a coworker or let's see, we've already done coworkers. So let's say it's with a significant other, your children, your adult children, your parents, being able to say no. Yeah. That's the huge thing, you know, being to say, what are the things that I need? How do I say no to things that don't need? I'm an adult now. I know what I need and what I don't need. Yeah. You can, because what'll happen is someone will manipulate you. Yeah. Especially somebody from family of origin who can say, we need. Yeah, you need to do this. And you feel like a terrible person if you don't. And then they make you overwhelmed with a persistent stressor. Yeah. So how do we say no and be okay with it? Yeah. You know, no, I can't do that. I love you, but I'm gonna serve you in other ways that work for me. Yeah. Say it not like a jerk, but it's really hard for people to say no to manipulation.
You know what? I was just thinking. We talked about 2 things of just like do it naturally. You're naturally made to do, but that one. Well, I mean, we can make an argument that it is natural, but that seems more of a learned behavior and something that may not come naturally to some people. Like you may have to learn how to do that. And it sounds like having someone to guide you through how to have those proper boundaries in your relationship is the only way you're going to learn it. Because if you didn't learn it from your other relationships, if it wasn't presented to you or acted out by your parents or by your friends or other coworkers, you wouldn't know how to have proper relationships.
Yeah. So therapists. Yeah. So that's where it's at. Get therapy. Yeah. Everybody needs to get therapy. So I grew up little kid all through high school as a swimmer. I always wanted to get faster. Yeah. So I train harder. But another way to get faster in swimming is get a stroke clinic. Yeah. Get a really good coach to tighten up your technique. So I'm accustomed in my life to asking people how to show me to do things. And I don't have the pride. I know I want to get better. And so my job lightened up briefly in 2013, and I said, I want to have a therapist. Like, my life's awesome now. I got low stress. I want to work on some stuff. Surely I got nothing to work on, but let's work on some stuff. Where can it be? Let's tighten up the technique, Yeah. And I went and saw a therapist, and I learned oh man, I'm letting people run over me this way. I'm doing this wrong. Oh my gosh, it's so empowering because I can say no. Hell yeah. And so I'm such a big advocate of everybody going to a good therapist. It's like a swim coach. That's all it is. It's like tightening up your game with a third party who can reflect back to you. They're not going to go like read your mind or do anything stupid to you. They're just going to give you, if they're trained and a good professional, they're going to give you feedback to make you more functional. And isn't that what we're seeking as athletes? You know?
Is it? Once I think that's the a very insightful thing that she says, like, I'm used to being coached, and so the idea of being coached was attractive to me. And much like when I think of, like, when I'm going to coach you, all right, you want to learn how to squat, I'm going to watch you squat. And I'm going to use that as a diagnostic tool to determine what's the best tools and techniques and strategies for me to give to you that then you learn to apply in your own squat. And, like, having worked with therapists, like, that's exactly what they do. And tell me about it. And you express, to them what happened, how you felt about it, what was going on in your brain. And they give you tools, tactics, strategies to then implement, and you get better.
Man, it's so true. I love it that you buy into that because, all those retired SEALs that do that swim with us, they all go see therapy and therapists, and they all agree with this. Yeah. They're all guys that are seeking functionality, but that's what they did in the SEAL teams. Show me where I'm wrong. How can I do this better? Then they retire, they come home, they're trying to become a lawyer, they're trying to do other careers, and that mindset still exists. Show me how I can do it better. Relationship is struggling. All right, let's go see a therapist. Show me how I can do this better. Yeah. So it's not a sign of weakness.
No.
The most functional people on the planet are seeing therapists.
Yeah, for sure. I mean, I think that you would do training. Well, you would want guidance and training to make your body optimize and function better. Same thing. I want guidance and training on how to make my brain, my emotions, my self-talk optimal and operate better.
Because we're drugged around by our family of origin habits. Yeah. That many are awesome from our loving parents. Many are not awesome, from peers or parents or whatever. Parents can be amazing parents and do their very best and still pass down some dysfunctional coping.
I would say that they 100% will.
Yeah, and this doesn't mean they're bad parents. No. Nobody's judging them. I mean, look, my parents are awesome. They came from the post-World War II generation. They're baby boomers, amazing people. Couldn't have asked for better parents. They'll be the first ones to say, hey, I probably didn't do this right, because we're all figuring it out together,
Well, yeah, because, look, no matter what you do, you're never going to be perfect in any of it. And, like, as a parent, I'm fully aware of, like, these are things I do well, and, man, sometimes I screw these things up. Well, I would assume that as my children look to me and learn, the things I screw up are going to be, maybe holes isn't the best analogy, but the things that I'm not doing great is going to impact them in some way. Mm-hmm. Even though I'm aware of it, I'm trying to improve it. There's probably going to be something within that, but like, I see a therapist to make myself better, so I can do a better job of that. Hopefully, they'll see a therapist to deal with that as well, and, like, that they'll slowly get better and better. So,
great.
Like, every generation will be a little bit better than the one before.
Yeah, and yeah. This young generation now is dealing with some unique stressors. Yep. As we talked about, and as an adolescent psychiatrist in the inpatient environment at Lakeside, I'm seeing a whole lot of young people trying to end their life. There's a lot of distress in the young community right now. So just throwing that out there is when you're saying a little better than the one before. Man, I hope that's correct. Yeah. And maybe our parents worried about us. We were drinking 24 beers and jumping off people's roofs into the pool. Yeah. I mean, they weren't doing that. Yeah. I mean, so it's, and maybe this is what it is, but I have a lot of hope for our next generation. They're dealing with some stuff though.
Yeah, for sure. I feel like my generation was really the first generation to be exposed to social media before adulthood. but it wasn't. I mean, I think I was a junior in college when Facebook was invented.
Yeah.
So it was like just at the tail end.
Yeah.
So my parents didn't have any, they had nothing to like guide me through that, but I was an adult and had to kind of learn it myself. But now this a generation, they are growing up with social media from the jump. And we just as a society don't have, I think we are now seeing the impacts of it. We haven't developed the tools around how to as a nation address it. But for a lot of kids, there was no awareness and no tools.
Mm-hmm. And it's not just passive social media existing adjacent to them.
Yeah.
There are PhD level smart people trying to figure out how to make them angry, outraged, insecure, all the ways to make them give more of their time so they can do more ad buys. So they're preyed upon. And then a more extreme example is social media is one of the main tools how sex traffickers contact young people posing as someone else in order to groom them into sex trafficking, which is a huge issue as well.
Yeah, so you got it's not passive. People are actively trying to negatively impact you.
Did you see The Social Dilemma on Netflix?
Yes.
Yeah. I mean, that's the leaders of that industry telling you how nefarious it is and how they're trying to get at at the brains of Americans, because the more you scroll, the more money they're making, you know?
Yeah, and I mean, I feel like this is a constant. I mean, even for myself, like I'm aware of like the negative impact of it, yet I'm trying to get a message across and get people's attention. And so it's like that, you know, it's you're trying to balance all that out. And, but more than anything, like I said, it's a crazy, sharp, double-edged sword that you better be. As a parent, I wouldn't give my kids like this crazy, sharp, double-edged sword without putting my hands on it with them for a very long time.
For sure.
And training them and teaching them and being very clear, like, this thing is a weapon. It is a tool, but it can hurt you and it can kill you.
That's
and therefore,
right.
I'm not letting you do this until I feel 100% confident. You can show me you know how to use this without hurting yourself.
That's an important point, because you're the parent. You can do social media all day long. You're consenting. They're not of consenting age.
Yeah.
They can't make decisions about their life for forever based on when they're 14 years old.
Yeah.
So we have to protect them, because they're not, even though they say they're consenting, they're not consenting to the stuff that can do to their brain.
They're consenting with lack of knowledge.
I mean, social media is great. It's how I got, you know, our American Addiction Center's Oxford Treatment Center through TikTok. And, you know, we got 10 million views on TikTok. We got 6 million views on YouTube Shorts. We're trying to spread this message of treatment works and treatment is available so we can end veteran suicide.
Yeah.
So we rely heavily on social media to save lives, but at the same time, it's got some other things we need to be aware of.
Yeah. So we've got exercise, sleep, therapy. What all other coping mechanisms do we have, or healthy coping mechanisms?
There was a study on the blue zones in Sardinia to look at why are so many people here living over 100 years old. And they looked at so many risk factors: smoking, diet, exercise, alcohol. They looked at everything. And sure, we know that smoking's unhealthy, but what beat all of them is the healthiest thing that these people had that caused them to live over 100 was social connectivity. Yeah. And so social connectivity can't be understated, can't be overstated. It's a coping skill. And what does that look like? It's about gifting yourself the time and availability to be around people that you love. It's why we go to exercise classes. Yeah. When we go to an exercise class, we're working out. More important than the workout, I would say, is the fact that we have social connectivity, which this study says makes you live a long time.
Yeah, 100%. Yeah, like I said, it's like the lack of social connections increases your risk of death by 50%.
It does.
Yeah, and what you said there was just like, and we can combine some of these things. You know, like I can go and exercise with other people, and I get 1-2 punch. How incredible is that? I have what I call the band of brothers approach, which is to do something incredibly physically hard with a group of people, and that will like create a social bond that will take you, that will carry you for a very long time.
It's amazing.
It's why a lot of people look back with fondness, like when they played high school or college football, or look back in their time in the military with fondness. It's like, well, I did the hardest thing I ever did with these people, and like I'm bonded to them for life. For a lot of us, I can't go back and play football. I can't join the military, but I can choose to go to do something very physically challenging with people I care about to solidify that bond.
It's beautiful. The two that stand out to me the most are the CrossFit community and the endurance community.
Yep.
So the CrossFit community, because they're doing functional movements, if they got a good coach, they're not going to push to injury. You know, there's in the early days of CrossFit, perhaps no, but now you've got these really wise coaches that are doing natural functional movements, and people are getting stronger and more functional. And that social connectivity, I mean, it's like a cult, and I love it when they use that word, because that means they're coming, they're engaged, they're talking about the paleo stuff they ate, and I mean, that's huge. And then the endurance community, they're doing an accessible zone 2 mostly training that anybody can do, and it's very like triathlon. You don't have to just be an ultra marathoner. You can do swim, bike, run, all these different multi-sport joints. None of them are getting too ragged. And then you got all these races you go to, and see you see your people. You're getting all the great healthy exercise. You're getting vitamin D outside, and you're seeing all your people. I just learned yesterday. I mean, I'm like so late to the game, but somebody told me I need to join this app called Strava.
Oh yeah,
because I do endurance training. And apparently Strava is like social media. Everybody shares their little pictures from their run. So I'm stoked about it because that's going to increase social connectivity for me, you know?
I think what's also unique about that stuff is like when you do a CrossFit workout, I mean, you are working out the whole time. If you're doing an endurance thing, like you're working out the whole time. And one thing, I've done bodybuilding and powerlifting competitively in the past. And one thing I've noticed from the time when I did it to what people are doing now is like we used to all train as a crew. We all trained collectively. There weren't any phones out. There were people. I don't think Instagram was like as big as it was back then. Facebook was around, but like the technology hadn't gotten to the point where you could like film a video, edit it, and drop it on social media. The people would like have their phones out to film a lift, but the purpose of that session was to get better, and it was very bonding. And like one of the things I've just seen over the years within those communities is headphones on in the gym. I don't talk to anyone. I'm here and I'm filming myself for social media, and I know that has actually caused a lot of mental health issues. Because even though they're exercising, which is great, their purpose behind it and their connection within it is probably not as healthy as it could be.
Right.
Whereas, like, I go to the CrossFit class and like I ain't got time to get my phone out and.
Well, I walked through a CrossFit class here the other day, and I saw Coach Angie greeting everyone. And I knew that what was forthcoming was going to be the guidance through physical exercise. But also what I heard her say was, hey, Jim, or whoever, how's your family?
Yeah.
And so I thought, okay, she's a physical guide, but she's also checking in on this human's family.
Yeah.
And I thought to myself, what a good, positive mental health asset that environment is. The other thing that is really positive about lifting and here in particular is that on Saturday mornings at 10 a.m., I come to this. I mean, I'm like I'm not a power lifter, but I come to the like big guy training because it is so fun to have like Motley Crue cranked up with these big, strong dudes who make me feel a part of the gang. Yeah. And there's like a little like 20-year-old female that's in there. Makes her feel part of the gang. Yeah. It gives me social connectivity. Then we take a big picture at the end. Yeah. That's so beautiful. I don't want the headphones. I don't want to be alone. I want to be with those guys.
Yeah, exactly. 100%. All right. So we got exercise. We got sleep, therapy, social connections. What else we got?
Nutrition.
Okay.
So what we put in our body is very important. Yeah. I mean, part of that is managing your lifestyle where you have time to put healthy things in your body. And can you afford healthy things? You know, I mean, there are tons of things that are very accessible, fruits and vegetables and, you know, lean protein sources that are affordable. In some communities, in the food deserts where you just got the corner store, that's pretty tough because you go through some of those places and it's all like just cereal and stuff.
Yeah.
That's tough. But if you can afford healthy nutrition and you can, and so I'm always like kind of forgiving with people. Like if we talk about a healthy diet and they may not be able to eat the absolute most paleo clean thing, I always love to meet people where they're at and say, man, you're doing your best. I know that your income is low. I know there's no grocery stores in your neighborhood, but look at all these positive choices you're making.
Yeah.
That's better than you could be doing. You know, what we put in our body, are we flooding ourselves with micronutrients? Are we keeping our blood glucose level stable? Are we doing processed carbs and then insulin and then hypoglycemia and hunger and then overeating? Are we in this? So, I mean, you can do so much with ADHD and depression and anxiety if you've got a stable blood glucose level. Even if you're running in a caloric deficit because you want to get in shape and get a little fitter and leaner, you can run a little caloric deficit as long as you're not blood sugar spiking. You can run a tiny caloric deficit, still feel so amazing. I can't tell you how many people will start eating clean and say that's better than medicine. I cut out bagels and dairy. Whoa, I feel so much better.
Yeah. Well, and it's what I kind of the flip side of that is if you're someone who's been exercising, has been eating clean, for whatever reason, you take a couple of days off or a week off, you binge, eat like crap over a weekend. You're like, I feel like for me, it happens like if maybe I have to go on like a business trip or something. Like I don't have any control, like the food options. I'm just like, screw it, you know. And you're like, I feel so bad. Like it's like I feel sick. Like I'm dragging. I feel like this is sludge in my body, and you're like, but that's some people's daily.
Yeah.
That's how they feel, and now they somewhat adapt to it and adjust to it because that's what they've known. But they could feel the stark difference in the other direction. But if you never experienced it, you don't know. If I was like, you have no idea how bad you feel.
That's right.
Whatever. And I actually experienced like, oh my gosh,
it's crazy. If you eat just natural, unprocessed stuff, but find what you like. Yeah. You know, like eat eggs with cheese, and eat the things that put salt on it, and that stuff that tastes good to you. Like, don't go eat some bird diet and think you're going to feel better. Craft a diet that's natural foods that taste good. Do you need to put some kind of seasoning and hot sauce on stuff? You can have a natural diet that tastes amazing.
100%.
And it just takes a little bit of thought and meal prep and planning. And when people do it, they say they feel amazing and they sleep better and they're happier.
Well, you hit on something like, look, like sometimes people are like, well, healthy eating is like, I eat these Quest bars and these keto cupcakes. I'm like, whoa. They're like, literally, like the more important than anything is like everything you should eat should have like one ingredient to it. Like an egg is an egg, a chicken is a chicken.
Yeah.
Even if you had like beef jerky because you live in a food desert, I'd rather you eat 10 bags of beef jerky than one Snickers bar.
Yeah.
You know what I mean?
Yeah. Well, a lot, it's true. And a lot of that health food, even vegan food, is super unhealthy. Rich Roll talks about he overcame addiction and he wanted to be a vegan, and he's doing ultra and he's doing all that. And he's eating all this vegan like pizza and stuff that's all processed, and he felt like crap. And then he went like true vegan, which he's a very big believer of. It's very compelling, where he like eats that way now and it's unprocessed. And that's when he started like winning all the races and doing everything. It was the leaving the processed foods behind that was the most important piece,
100%. And I think there's when people are like, I feel better. It's like, okay, do you feel better because of the foods you introduced? So sometimes when people go to vegan diets, they're like, I started eating more fruits and vegetables. Like, do you feel better because you've now introduced fiber and micronutrients and natural foods to your body? Mm-hmm. And because you've eliminated, and by doing so, you've eliminated some of the processed stuff. And I think there's like the power of most of the diets. It's you're going to feel like crap, whatever diet you're on, if you use primarily crappy food sources and a bunch of processed food.
Yeah, it was so true.
All the diets that tend to work, like involve eating foods that are natural foods, single ingredient foods, you know.
Find creative ways to make them taste delicious.
Yeah.
Though. Yeah. It doesn't have to be boring.
No, all day long. You put, like I said, you put all kinds of tasty, like, there's a bajillion herbs out there.
Yeah.
They're totally healthy for you and fine. You don't have to boil chicken breast. You know, you don't have to do steamed broccoli. I mean, you can if you want to, but like.
So for somebody, this is a good point. For somebody with hypertension, we have to be salt conscious.
Yeah.
If you don't have hypertension, salt is what you need.
Yeah.
You have way more chance of dying of hyponatremia than you do of a salt load. But salt's been a discovery of the past 10 years.
Yeah.
We have to salt our food. Unless you are a population who's been told because you have hypertension and renal disease and stuff like that. Okay, not talking to you, but for the vast majority of the people, they're restricting salt too much in the athletic community, I think.
Your body is really good at adjusting, you know, its water and electrolyte levels. If you eat salt, your body's going to take care of it. That's what it's designed to do. Now, if you have dysfunction in your body because you have renal failure, your body can now not adjust this well. So, we're not going to overload that system. But for the average healthy human, it's like your body can be fine if you eat salt. Like,
it's great, especially if you're an athlete. You have to be salting your food.
Yeah. You need those electrolytes. Nutrition. What else do we have?
So I think what undergirds all of this, all of these things that we can. Well, before I say that, something you said that I wanted to come back and comment on had to do with cognitive flexibility. So the difference between a healthy lifestyle and disordered eating is when you can go to this conference and of course you want to eat the way that makes you feel good and is healthy. But if you can't, and you're there for business purposes and a lot relies on that, you had the cognitive flexibility to say, I got to roll with it. That's the difference between disordered eating and healthy lifestyle. Sometimes in healthy lifestyle, it's impossible and you've got to have cognitive flexibility. Or it's my birthday. I wanted to eat all 3 pieces of cake and I didn't blow anything. It gave me dopamine. I made an adult choice. Tomorrow I'm going to eat in the way that makes me feel good. So you can have slips like that or cheat meals or whatever. And that's part of the healthy diet.
Yeah, 100%. I encourage people to say like use food has multiple purposes, and one of those purposes is pleasure and social connection. Mm-hmm. So you use it intelligently.
So important. Social connection through food. If you don't know that, you've never been to Italy.
Yeah.
All they do is eat and talk, you know.
The we've done nutrition coaching for people in the past to measure out their food and take it in a Tupperware container to like Thanksgiving. And you're like, you have an eating disorder. And in their head, they think I'm so serious about my nutrition. I'm like, no, that's an eating disorder.
Because it's so much control.
It's just so control, and fearful. If I don't do this, what will happen? Yeah, and
nothing will happen. You might even lose a little bit of weight. Your body will use it. It'll build some muscle.
Yeah.
So you asked me what's another coping strategy. What undergirds all of these things that we can name and quantify is just sort of this more global idea that, okay, you deserve this. You need to be doing this for longevity, but you deserve it. Slow down your life, make a plan, say no to certain things so you can put all these coping strategies in place. And most of the time when I hear people say, I can't do it because I get this, go see your therapist and work out a plan because you can do it. I promise there's a way. Yeah. Because the guy that's got like no use of his legs is doing it.
Yeah.
And it's very, very difficult to get in and out of the car and drive the car only with hands. And there's so many, but that guy's here, So how do we get people to do these things that we know work and that we've named? Usually for me, it's meeting them where they're at and focusing on their assets and telling them they deserve to be able to do all these things that are going to make them feel good. For some reason, a lot of people don't do that. But maybe they don't think that I've got to work. I've got to do this. I've got to do that. No, you've got to live and you deserve to live. You're a human.
Yeah.
Compassion to yourself, Yeah,
I love that. Something that's helped me as a competitive, results-driven entrepreneur type I think different people kind of operate in different spheres of time, and my time zone is like the next year. You know, you're always kind of focusing like, oh, what's our plan for like the next year, right? Which is good. It has beneficial qualities, but the problem with that is it steals the past, the present, and the far future from you sometimes. And so a couple of things that I have to remind myself of is, hey man, like you're doing the stuff that you do so that you can live a full life, a full extended life. So some of the things that you see other people doing, you don't need to be chasing, because you're not trying to like get it all and retire at 65 and have a couple of good years. Like you're trying to make it to 90, 100 and be healthy and fit at that point, which means you got longer times. Maybe today you don't have to do all that stuff. Maybe today you could take some time for yourself. You know, you could experience the present a little bit more. So that's been helpful to me, is to remember, hey, remember the far future so that you'll live in the present a little bit better.
That's a very therapeutic thing you're saying. You know, we all need to hear that. I need to hear that.
Yeah.
That's powerful. Yeah, because people are destroying themselves in order to get financially to where they want to be. And their kids, that's the only time they're going to be with their kids.
Yep.
Those kids, their neurodevelopment will be over and they'll be adults, and they missed out because they were trying to retire at 65. Or the people who are destroying their bodies because they want to get a PR.
Yeah.
They're not thinking about what those joints are going to be when they're 90.
Yeah, 100%.
You can take that too far.
Like where if you kind of think like, this is my only period of time I can do this thing, then let me actually do that thing, versus constantly sacrificing this for maybe this potential, 10, 20 year thing. And I'm not saying one's like, you have to balance it all out. You can't just, you can't just full go, whatever, the future that will happen, and I'm just going to live for today. Like, there's got to be some planning in there. But what I find too many people do is maybe they're too overwhelmed by the present, too focused on, they just get stuck in this mode of like, this is how I do things. You'd be like I literally had a call with a lady today. It was like, I'm just super busy right now. I'm just super busy. Like, and like, you saying that just puts into your head that when I'm busy, fitness isn't a priority. Mm-hmm. The outcome of that is an early death, period. So then maybe let's change our words. Like, I'm too busy right now. I'm so busy right now, I want to die early. That is a statement we're making right now. If that doesn't line up with like what your values are and your beliefs, maybe let's change that and say, maybe I shouldn't be so busy.
Yeah, man, that's a powerful statement. That'll get your attention.
Yeah, it didn't work on her, but
I tell people, I say, because mantras I think are important like that. I say, you're doing all this for all these people. Apply the compassion that you apply to them. Apply that to yourself. You deserve that.
Yeah, 100%.
I like that.
Love it. Very cool. Well, we're coming to the end here. Let's send it off with like something that someone can take away right now, maybe encouragement to them to like pursue their mental health.
Yeah. So the listeners to this podcast, each is a human who had a family that loved them and now is probably doing leadership roles in their life to try to help others, and is probably working pretty darn hard and has made a lot of sacrifices to do that. That family relies on you to be strong. So taking care of yourself isn't selfish. It's a gift to all the people who rely on you. Because if you grind, your body might decide at some point that it's time to check out and have a 6-month depressive episode.
Yeah.
Number one. Number two, just this overall just sense that, man, because you're human, because you're someone who exists in this world, man, that is such a rare and beautiful thing. You deserve to take the step towards mental health. And guess what? That grind you feel yourself in, that toxic relationship stress, the family of origin BS that you know is out there, the work stress, your boss, guess what? You can do things differently. Help is out there. That help can work for you. Maybe it looks like a therapist, but it's a step that a third party can take with you to help you readjust your life so you can flourish rather than just grind. And you deserve that.
Love it. Thank you so much, Lucas. All right, NBS Fitness Radio out.